So we're going to go over the muscles that move the thigh. And our first muscle is going to be the sartorius. So I'm going to highlight the sartorius right here. The sartorius is going to originate on the ilium and is going to insert on the tibia. And so you can see it's going to kind of cross along and enter on the medial side of the leg and is going to insert on the actual tibia. So again, this is the sartorius. Here we have the sartorius flexing the thigh. So here we have lateral rotation of the thigh. Here we go again, right here. Our next muscle is the tensor fasciae latae, and this is going to be a muscle that is on the lateral side of the leg. I'm going to highlight it right there. The tensor fasciae latae is going to have an origin on the ilium and is going to insert on the iliotibial tract, which is this structure right here. If you've ever heard anyone say IT band, this is what they're talking about. So that is going to be how the tensor fasciae latae is going to insert. So here we have a hip abduction, right? So you're kind of pulling your leg away from the body. So that's abduction with a B. Here we have a video of hip flexion. And here we have rotation of the thigh medially. Taking that knee and rotating it towards the midline. Our next muscle is the iliopsoas, and it's actually two different muscles, but we're going to consider it one. So it is going to be both the psoas major muscle and the iliacus muscle. So what I'm going to do is I'm going to select both of those muscles and then we will isolate them. So here are the iliacus is going to be the muscle that is going to have a origin on the ilium, and the psoas is going to have an origin on the thoracic or the lumbar vertebra. Okay, and they're both going to then have their insertion on the femur. Okay, so again, this is technically two different muscles, the iliacus and the psoas major, but we're considering it one muscle, which is the iliopsoas. Here we have the thigh flexing toward the trunk. Our next muscles are going to be on the posterior side, and they're actually going to include your posterior, as some people call it. So we are going to now talk about the gluteus maximus, medius, and minimus. And the gluteus maximus is going to be the superficial muscle, and it's the largest. That's why it has the name maximus. So here we have the gluteus maximus. If we hide the gluteus maximus, we can then kind of see the deeper muscles. The gluteus medius is going to be this muscle right here. Okay, so it's in the middle. And if we remove that muscle, we'll hide it. We then have the gluteus minimus, which is going to be the most deep muscle of the three. Okay, so we have gluteus minimus, which is going to be the deepest and the smallest. We then are going to have our next muscle on top of that, which is our gluteus medius. All right, and then if we take back and we have now our gluteus maximus. Get it back on there. 1 second. There it goes. There is our gluteus maximus. Here we have the gluteus maximus, and it is extending the thigh at the hip. So this is kind of when you would kick your heel backwards, and it uses that gluteus maximus muscle. Here we have lateral rotation of the thigh, and you can kind of see that you would take your thigh and rotate it laterally. And that's going to include the gluteus maximus. I'll show you what it looks like from in the front. So you're going to take your knee and rotate. Here we have hip abduction with a B, and both the gluteus maximus, the gluteus medius, and the gluteus minimus are all going to participate in this. Okay, so this would be taking your leg and kind of lifting it off to the side. Here it looks from the front. Okay, so again, abduction with a B. So here we have both the gluteus medius and the gluteus minimus doing a medial rotation of the hip. Okay, so this is from the back. It's a little hard to see. So I'm going to take you, and so this is going to be from the front. And so you lift it up, and then you would rotate your thigh medially. So towards the midline, towards the middle of your body. And both the gluteus medius and the gluteus minimus are going to participate in that movement. Okay, so you can see that both of them light up when you do that medial rotation.